name's Allie France. I'm a physical therapist with St. Luke's Physical Therapy in the Northeast PA. I'm here to talk to you today a little bit about ways to improve your hip mobility. So if you have a limitation in your hip mobility, it can lead to an array of problems. You can have difficulty with climbing stairs, walking, running, jumping, etc. If you don't have adequate hip motion, it can lead to decreased nutrition to the cartilage and to the joint. It can also lead to further breakdown and degradation. So today I just wanted to go through a couple of exercises that could be helpful for this. It's very important that none of these should cause an increase in pain. The first one that I want to do is what we call quadruped rocking. So what you're going to do is you're going to get on all fours, on your knees, and then in your hands. Your feet should be hanging off of the table. You're just going to, the key is you push through your hands as you kind of push back towards. And when you feel a stretch, you're going to hold that there for about 10 seconds and repeat it 10 times. And go ahead and relax. Now, if that doesn't give you a good stretch in your hip, what you can do, and as long as you don't have any back problems, you can actually sink your back down towards the table, hold that there, and then rock back. Stop right there. You want to make sure that your back remains curved like that, and it doesn't start to flatten out, and then you can relax. That would be the same thing, 10 seconds, 10 times. Now, there's another modification that we can do to this exercise. We can simply just take our leg, rotate it in so that we can work on what we call an internal rotation stretch of the hip. You would do the same thing, lock out your back and rock back where you can comfortably, pushing through your hands, holding it for 10 seconds, 10 times. Go ahead and relax. Now the next stretch that I want to show you is a stretch for what's called your hip flexor. That's going to help improve your hip extension. So what you're going to do is you're going to lie down on a table and you're going to scoop towards the edge. The leg that you want to stretch is going to be the leg that comes down, and you just hang out and let it relax. Make sure that this knee is bent so that it doesn't bother your back, and if it's bothering it in this position, you can actually take this knee in towards your chest, like so. You would hold that for 30 seconds and repeat that 4 times. Okay, so I'm going to move over. Now the next stretch that I'm going to show you is for hip external rotation. Again, very important to keep this moving and going. So there's going to be 2 ways we can do this. The first one's in lying down. You just take the leg that you want to stretch and you would just place it across on the other one, and then you can use your hand for a little bit of overpressure to push your knee out that way. You would hold that the same way, 30 seconds, 4 times. If you don't have a way to lie down or you're not feeling a very good stretch while you're lying down, you can do the same thing in sitting. So I'm going to come sit here. Take a seat. The leg that you want to stretch is kind of going to go up and over like you're making a figure 4. And you can again apply some overpressure with your hand, holding it for that 30 seconds 4 times. It's very important that none of these stretches cause an increase in pain. If they do, please stop and contact your physical therapist. Thank you.